You've been dealing with shoulder pain with benching, pressing, and other upright type movements. Like a lot of lifters, you go to your physician or your physical therapist to get some help with it, and they tell you that you have shoulder impingement. This is one of the most common situations that lifters experience, but the question is, what do you actually do about it? My name is Ryan Van Nieuwenhuizen. I'm a doctor of physical therapy and a lifter myself, and today I'm going to show you how to fix your shoulder impingement in just 3 easy steps. Before we actually jump into the steps and what to do, it's kind of important to discuss a little bit about shoulder impingement itself. Impingement in the shoulder joint is when soft tissues such as tendons and bursa get compressed or pinched between two bony structures. Historically, this has been labeled as a cause for pain and injuries in the shoulder, but what we actually know now is that physical compression or impingement of those soft tissues in the shoulder is completely normal and very poorly, if at all, correlated with pain. That compression or impingement happens in pretty much everybody as soon as you start raising your arms overhead, and I actually made a video detailing why we no longer think that shoulder impingement is a cause of pain. And you can check it out at the link above for a much more thorough explanation. While this may seem like semantics or just a little non-important detail, I did want to point this out because it actually is more important than most people feel. What your healthcare provider, such as your doctor, physical therapist, or chiropractor, tells you about your injury and your pain and your rehab can help shape your outcomes and determine whether you're going to have better or worse outcomes. And it's also been found that when people are told that they have this physical compression or impingement in the shoulder that's causing their pain, it can negatively affect how well they do. It can lead people to think that they have to avoid exercise, that rehabbing their shoulder can't fix anything, or that they need invasive surgery in order to solve the problem and get out of pain and back to the stuff that they want to do. But luckily, none of this is true. The vast majority of people in general and lifters who deal with shoulder pain can effectively rehab their shoulder pain and get back to their goals and what they want to do without having to go through surgery or just stop the activities that they love. And I'm going to show you 3 steps that I use with a ton of my own clients to help them get out of pain and get back to heavy benching, overhead pressing, snatching, and all the other stuff that they want to do in the gym. The first and arguably most important step is to modify what you're doing in the gym. You probably don't want to completely stop training because then you can become detrained, and while you may likely feel better because you're not doing the stuff that aggravates your shoulder, when you get back to training, you're likely going to be at a higher risk for re-aggravating that injury or having a flare-up or just injuring something in general because you have become detrained and your body's ability to handle training stress is going to be lower. But just like if you keep punching a bruise that you have, if you keep on doing the things in the gym that are causing or irritating your pain, it's going to take a lot longer to heal. Most lifters find that pressing movements and overhead type training are the most aggravating for their shoulder pain. Simple tweaks that you can make to the movements that do cause your pain are to slow down the tempo of the movement, use partial ranges of motion to avoid the bottom position movement, such as in benching and overhead pressing where the pain is often the worst, or switching to something like dumbbells or a landmine variation if regular barbell pressing and lifting causes your shoulder pain. The goal is to find a modification that still allows you to train, but with no more than typically a 3 or 4 out of 10 pain, and then progress that over time back to more normal training. Step 2 is to build up the strength and the capacity of some of the other muscle groups that do support your shoulder, such as your rotator cuff and your serratus anterior. For direct rotator cuff training, I often have a lot of my clients start with either dumbbell or cable external rotations, but with their elbow at their side because this is usually tolerated quite well by the shoulder. I'll have my clients start typically with 2 to 3 sets of 12 to 15 reps, and then progress over time to heavier sets of 6 to 8 reps as their pain subsides and their performance increases. After this, I'll very typically start to progress the rotator cuff training so that they're in a more overhead position to mimic the demands of overhead lifting and prepare them to return to those activities. One of my personal favorite options is the 90-90 cable external rotation. To perform this exercise, just grab a cable and anchor it low to the ground, and then grab an adjustable bench, incline it up so that the bench is about shoulder height, and put it in front of the cable. From there, just grab the handle, place your elbow on the bench, and externally rotate your shoulder so that your hand ends up pointing up towards the ceiling. Another one of my favorite exercises is the prone triple threat. This is a very similar motion to the cable external rotation, but now we're actually adding an overhead press component to the motion itself. All you have to do is grab an adjustable bench and set it to the lowest incline possible. Grab a pair of quite light dumbbells or plates, lie on the bench, perform a row, keeping your elbows high and wide, and then externally rotate your shoulders, and then press overhead, keeping your hands as far away from the floor as is possible or comfortable. And lastly is a half get-up kettlebell screwdriver. Grab a kettlebell and get into a half get-up position, propped up on your elbow. Press the kettlebell directly upwards so your hand is stacked directly over your shoulder, and then from there, internally and externally rotate from your shoulder joint itself as far as is comfortable. The key is you don't want to just rotate the forearm and the wrist, you actually want the rotation to come from the shoulder joint itself. Just like the first exercise, I'll usually program these for 2 to 3 lighter sets of 12 to 15 reps, and then progress them over time to heavier loading in a lower rep range. Next up is your serratus anterior, which is a muscle that attaches to your shoulder blade and your ribs, and its job is primarily to protract and upwardly rotate your shoulder blades, which is an important part of overhead lifting. One of my favorite exercises to directly train this is the half-kneeling landmine serratus punch. Grab a barbell and set up in a landmine attachment or in the corner of a wall with padding if needed if you don't have a landmine attachment, and get into a half-kneeling position. From here, press the bar away from you so that your elbow is fully locked out, and then shrug your shoulder blade up and forward as far as you can. I like to start with the torso in a pretty upright position to limit overhead loading, and then as the shoulder becomes less painful and more tolerant of overhead positions over time, you can slowly start to angle your torso forward to get into a more overhead position. For this drill, I'll typically program 2 to 3 sets of about 6 to 8 reps with a 2 to 3 second hold in the fully shrugged position. And the last step is to improve your thoracic spine mobility. Your T-spine will have an impact on how you move during pressing and especially overhead activities, so it can have an impact on shoulder pain. The two main motions that I focus on with my clients are typically T-spine extension and rotation. For thoracic spine extension, my favorite drill is the foam roller thoracic extension mobilization. Grab a foam roller and a relatively light dumbbell or plate and lie on the ground with the foam roller directly underneath your shoulder blades and your feet propped against the wall. Place the weight behind your head or across your chest, whatever is more comfortable, and from here, slowly extend your T-spine over the foam roller, holding for a 5 to 10 second pause at the bottom. I typically have my clients do 2 to 3 sets of 5 reps for this drill. And the second drill is a band-assisted thread the needle for thoracic spine rotation. Grab a relatively thick resistance band and anchor it fairly low on a squat rack or something else that won't move. Grab the band with one hand and move away from the anchor point so there's a decent amount of tension on the band, but ensuring that it's pulling your hand across your body. Get in a quadruped or all fours position with your butt on your heels, and then let the band slowly pull your hand across your body, rotating from the thoracic spine itself. You should feel a pretty decent stretch in your upper back and hold this stretch for 5 to 10 seconds. Just like the foam roller drill, I often program this for 2 to 3 sets of 5 reps. Not only can these drills be a great way to help resolve your shoulder pain, but they can also be a fantastic way to warm up prior to upper body training if you want to do a little bit more than just a barbell warm up. If you found this video to be helpful, please give this video a like and make sure to subscribe to my channel for more information on rehab, injuries, and training.